Imagine this: a man is wheeled into an operating room to have his diseased leg amputated. He's prepared for this moment, trusting the professionals to relieve his pain. But in a horrifying turn, a series of simple, preventable mistakes leads the surgical team to remove his healthy leg instead. This isn't the plot of a thriller movie. It happened. And this is just one of 5 unbelievable medical procedures from around the world that took a shocking turn. We place our lives in the hands of doctors, expecting their expertise to be a shield against the worst. But the systems they work in are run by human beings, and that makes them fallible. From a single misread chart to an entire hospital plagued by the same recurring nightmare, these are the stories of when the system failed in the most shocking ways imaginable. The 50-50 chance that went horribly wrong. Our first story takes us to Florida in 1995, and to a 52-year-old man named Willie King. King was diabetic and had severe vascular disease, which had badly damaged his right leg. After talking with his doctors, the difficult decision was made to amputate the leg below the knee. It was supposed to be a routine, if life-altering, procedure. The nightmare didn't begin with a slip of the scalpel, but with a series of quiet, seemingly minor administrative mistakes. The first domino fell when the wrong leg was prepped for surgery. That mistake was then copied onto the operating room blackboard, entered into the hospital's computer, and even put on the official schedule. A chain of errors, each one confirming the last, was setting the stage for disaster. Inside the operating room, surgeon Dr. Rolando Sanchez began the procedure. He saw the prepped leg, he likely saw the notes, and he proceeded. He amputated Willie King's left leg. His healthy left leg. Only after the surgery was complete was the catastrophic mistake discovered. King, who went into the hospital to remove a source of pain, woke up to a new reality where he'd lost both of his legs, one to disease, and the other to a string of inexcusable errors. The fallout was immense. How could something like this possibly happen? An investigation revealed the multiple points where the hospital's pre-surgical checks failed. It was a textbook case of what experts call a never event, a mistake so awful it should never, ever happen. In the aftermath, the hospital settled with King for $900,000, and Dr. Sanchez personally paid $250,000. Willie King's case became a haunting reminder in the medical community of how a series of small oversights can lead to an irreversible tragedy. But as shocking as this story is, it's far from the only time a surgeon has removed a perfectly healthy body part. The kidney that vanished. Imagine going into a hospital for a routine procedure on one organ, only to wake up and find out the surgeon removed a completely different one. That's exactly what happened to an 84-year-old woman in Massachusetts in 2006. She was at Milford Regional Medical Center for a straightforward gallbladder removal. Her surgeon, Dr. Patrick M. McEnany, had her chart, her test results, and was ready to go. But somewhere between reviewing the files and entering the operating room, a critical error was made. Dr. McEnany misread the lab test results. Instead of confirming the location of the gallbladder, he became convinced he was supposed to remove a kidney. He went ahead with the surgery, meticulously removing the woman's healthy right kidney. The diseased gallbladder, the actual reason she was there, was left untouched. The mistake was another horrifying, never event, a term for surgical errors so shocking and preventable they're considered to be in a class of their own. The error wasn't discovered right away. It was only later, when the patient's condition didn't improve as expected, that a review was triggered, and the almost unbelievable truth came out. You might think the consequences for the surgeon would be severe, but they weren't. The state medical board put Dr. McEnany on probation, allowing him to continue practicing medicine under supervision. For the patient, the outcome was life-altering. She went through a major, invasive surgery for nothing, lost a vital organ, and still had to face another procedure to fix her original gallbladder problem. This case highlights a terrifying vulnerability. Even with all our modern protocols, one doctor's misreading of one test can lead to a devastating and permanent outcome. A hospital's year of nightmares. 1 wrong site surgery is a tragedy. 2 is a crisis. But 3, at the same hospital, in less than a year. That's a full-blown systemic catastrophe. And that's exactly what happened at Rhode Island Hospital in 2007, a prestigious teaching hospital for Brown University. This wasn't a single twist. It was an epidemic of the same horrifying mistake, operating on the wrong side of a patient's brain. The first incident involved a third-year resident performing brain surgery. In a huge oversight, the resident didn't mark which side of the head was supposed to be operated on. Even worse, the pre-op checklist, a tool designed specifically to prevent this, was skipped. The surgery went ahead on the wrong side of the patient's skull. The explanation was chillingly simple. The team claimed they weren't properly trained to use the checklist. You'd think an event like this would force an immediate, unbreakable overhaul of safety procedures. But just a few months later, it happened again. This time, the surgeon was a 20-year veteran. He reportedly dismissed a nurse's question, assuring her he knew which side of the 86-year-old patient's brain had the blood clot and didn't need to mark the site or do the paperwork. He was wrong. He operated on the wrong side. Then, the unthinkable happened a third time. On November 23, 2007, a chief resident started to operate on the wrong side of an 82-year-old patient's brain. Though this patient reportedly survived without lasting harm from the error itself, one of the other patients who had a wrong site surgery that year died a few weeks later. The pattern was undeniable. The State Department of Health was alarmed, fining the hospital $50,000 for its continuing pattern of failure and ordering changes. The story of Rhode Island Hospital in 2007 is a terrifying look at how ego, overconfidence, and a failure to follow basic rules can defeat even the best systems, with deadly consequences. These stories are almost impossible to believe, but they're a stark reminder of the human element in medicine. If you're finding these accounts as fascinating as they are shocking, make sure to hit that subscribe button and turn on notifications so you don't miss our explorations into the strange and unbelievable. Now, our next story isn't about a slip of the knife, but a failure of the mind, leading to one of the most terrifying experiences a patient could ever have. The waking nightmare for most of us, surgery is oblivion. We're put to sleep, we feel nothing, and we wake up when it's over. But what if you didn't fall asleep? What if you were paralyzed, unable to move or scream, but fully conscious for every single moment? This is the horror of anesthesia awareness, and it was the reality for Sherman Sizemore, a Baptist minister from West Virginia, in 2006. Sizemore was at Raleigh General Hospital for an exploratory surgery to find the cause of his abdominal pain. During the procedure, the anesthesiology team administered paralyzing drugs, which are standard in many surgeries. But they made a catastrophic mistake. They failed to administer the general anesthetic, the drugs that would render him unconscious, until 16 minutes after the first incision was made into his abdomen. For 16 minutes, Sherman Sizemore lay on the table, completely aware. He felt the surgeon's scalpel slice into his body. He could hear the staff talking around him. But he was utterly helpless, trapped inside a body that wouldn't respond. He couldn't move a finger, make a sound, or even blink to signal his horrifying predicament. It's a scenario that's almost too terrifying to comprehend. After the surgery, no one told Sizemore what had happened. He was left alone with his memories, tormented by whether what he experienced was real or just a nightmare. In the 2 weeks that followed, he was a changed man. He had debilitating nightmares, couldn't sleep, and refused to be left alone, telling his family that people were trying to bury him alive. The psychological trauma was immense and unbearable. On February 2, 2006, just 2 weeks after his surgery, Sherman Sizemore took his own life. His family, who said he had no history of psychological issues, filed a lawsuit, claiming his suicide was a direct result of the unimaginable trauma he endured on that operating table. A gift of life, a fatal mismatch. Our final story is perhaps the most tragic of all, because it began with so much hope. In 2003, 17-year-old Jessica Santillan was at Duke University Hospital, waiting for a life-saving heart and lung transplant. She had a congenital heart condition, and this transplant was her only chance at a future. After a long wait, the news finally came. A donor had been found. Her family was overjoyed. The gift of life was just one surgery away. The operation went ahead, and the new organs were placed inside Jessica's body. But almost immediately, something went catastrophically wrong. Her body began to violently reject the new heart and lungs. Her system went into shock as doctors scrambled to figure out why. The reason, when it was discovered, was as simple as it was devastating. In a shocking oversight, no one on the transplant team had double-checked the donor's blood type. The donor had type A blood. Jessica had type O blood. It was a fatal mismatch. The incompatible organs ravaged Jessica's body, causing severe and irreversible brain damage. For 11 agonizing days, the hospital hid the mistake before finally going public in a desperate search for a second set of compatible organs. A new heart and lungs were found, and a second transplant was performed, but it was too late. The damage was done. Shortly after the second operation, Jessica Santillan was declared brain dead and died in the hospital. The promising teenager who came to the hospital full of hope had her life cut short not by her disease, but by a clerical error that the most basic of checks should have caught. In the wake of her death, Duke University Hospital reached an undisclosed settlement with her family. Jessica's tragic and entirely preventable death also prompted the United Network for Organ Sharing to implement a new nationwide policy, mandating that at least 2 people must independently verify the blood types of a donor and recipient before any transplant can proceed. It was a change born from a tragedy that never should have happened. From a leg amputated in error to a blood type that was never checked, these 5 stories show the fragile line between healing and catastrophe. They show us that medical errors are rarely the result of a single, dramatic failure. More often, they're a cascade of small mistakes, ignored checklists, and flawed communication. These are the never events that aren't supposed to happen, but still do. These cases are a powerful reminder that behind the advanced technology and sterile operating rooms, medicine is an intensely human endeavor. And where there are humans, there is potential for error, for ego, and for tragedy. The stories of Willie King, Sherman Sizemore, and Jessica Santillan aren't just cautionary tales. They've become catalysts for change, forcing hospitals and doctors to re-examine the sacred trust patients place in them every single day. Thank you for joining us for this look into some of the most shocking medical operations in history. If you have any thoughts on these cases, please share them in the comments below. And for more deep dives into unbelievable stories, don't forget to subscribe. We'll see you next time.